Well, here we are again. Happy Wednesday. We're here to talk about some locum tenens stuff. We're really about healthcare in general, right? But today's topic, because I always like to bring up a new topic, different specialty, whatever it may be. But the big one that hits home for me is psychiatry, okay? I was reading a couple different articles, some published by the CDC, some by some private entities, research they've done. A couple things I found out. Obviously, people have dealt with depression, anxiety, stress, things like that for years, right? It's just the way it is. But since COVID, okay, since COVID-19 pandemic, there has been a profound amount of people that have had an increase of mental health and psychiatric disorders, okay? A couple of key points, okay? So the CDC is saying that, and some other research are saying that there was a big increase of disorders of anxiety, depression. Psychiatric treatment centers reported that there were longer wait times to get people in for help and for mental health disorders. Some people also dealt with post-COVID conditions, one of them being called long COVID. Now, I don't want to get too much into long COVID because, let's face it, long COVID, they'll deny how it is, but long COVID actually comes from the vaccines itself, to where you actually can be sick for months or even a year at a time. And that's due to the spike proteins that come from the shot itself. That's not what we're here to talk about. But what happens is some people misdiagnose long COVID for some kind of psychiatric disorder. So then they send them to a psychiatrist. The psychiatrist ends up prescribing them a medication that they probably shouldn't be on. Then it throws their whole system off. So there's a lot of impacts that have happened since then, especially with just what people need in life, right? I mean, our lives are hard enough, right? Work shouldn't be. The stresses of COVID was a profound impact on the world. It impacted so many people. I mean, it's terrible. It really is. But there's a couple quick numbers I wanted to read off about this. And these are reports that came from China, Spain, Italy, Iran, and the U.S. Okay? So these 5 countries reported anxiety went from 6% to 50%. Depression went from 14% to 48%. You got people cooped up in their houses all day long, right? When they were on lockdown. Think about this. PTSD, post-traumatic stress disorder, went from 7% to 54%. Insane, okay? That's crazy. And then stress levels. They're saying stress went from 8% to 82%. So you're basically telling me 8 out of 10 people, 4 out of 5 people are overly stressed. Now, obviously this is during the pandemic, things like that. I feel like a lot of things have tapered off. Some people are still stressed about what's going on in the world. But the important thing is to understand is that people need psychiatric help. Your mental health is very, very important. And I always tell people, if you want to improve your mental health, start with your physical health, because your physical health will improve your mental health. But if you need to see a psychiatrist, we all need certain things. We all operate differently. Our brains have different chemistries to them. So obviously there has been a very large spike in psychiatric needs, especially in the locums field. So if you are a hospital or facility looking for, or a physician, psychiatrist looking for opportunities, you know who to call. Call Nortec. We got your back. Until next time, I'll see you next week. Have a great day.